And last but certainly not least in this closing session, Virginia McCririck, who's had a varied career in the public and the private sector and is currently on secondment to the Department of Health, transforming the adult social care workforce and supporting development of the third sector in the region.
Hi, good afternoon. Yes, I work with the Regional Social Care Team, which I should say is about to be disbanded, but not all in vain, because local authorities are picking up the mantle about how to transform adult social care. And hopefully at the end of this 3-year programme, the building blocks have been put in place to continue that transformation. The new vision for adult social care has now been published. It's hot off the press. It's called Think Local, Act Personal, and it's out for consultation. And I'll make sure that Roger sends out to you by email the link to the document. The consultation closes on the 30th of November, and all the things that you will have heard of so far in terms of what transforming social care means, i.e. choice and control, personal budgets, universal provision to all, that basically continues, but with more vigour, more speed and more localism, and certainly sees much more activity within the voluntary and community sector. And in that guise, local authorities have a particular responsibility to look at the workforce needs across the social care economy. So that will include your types of organisations, to make sure that the people who work in your organisations and the volunteers are aware of the types of changes to enable people who use social care services to get the best outcomes for them to enjoy their lives. So if you haven't yet been contacted by your local authority, I would start beating on the door basically, asking them what they perceive to be the changing patterns for social care delivery, so that you can start to think about what does that mean for your organisation, what does that mean for the training and skills that your paid staff and your volunteers actually need. Because the integrated local area workforce strategy, which local authorities have to produce by the end of March next year, requires your involvement. Just why is this so important? I won't go through this in detail. You know these demographics, they're quite frightening. We know that the number of people over 100 will quadruple by 2025, and a large proportion of those people inevitably will suffer from dementia. The same is true with the number of people over 80. Skills for Care have done an estimate of the impact of that on the workforce numbers for social care delivery, and it's frightening. We currently have 1.5 million employees in this sector. That doesn't include all the volunteers that you engage with. And if things stay the way they are now, that would mean that workforce would need to double. Well, the country can't afford that. So something has to happen quite dramatically to deliver social care in a completely different way, which will require different skills, different partnerships, and different approaches in the future. This is what the workforce looks like now. 20 years ago, it would have looked significantly different. That column on the left-hand side, would have been significantly smaller, and the number of people in councils would have been much higher. I anticipate that that column of private sector, voluntary sector will continue to increase, and those in councils will decrease, and the people employed directly by people who use services will go up quite considerably. So what next? Do take the time to visit the Skills for Care stand. There's lots of information there about what all of this will mean for the workforce in terms of assistive technology, role redesign, new focus on reablement type services. I'll certainly be covering some of those things in the workshop session next to help you start to think about what could that mean for you. Think about how your organisation can contribute to social care delivery in its changed form, and find ways to get your voice heard by your local authority. They have the information about how demand will change. And in terms of this new document, Think Local, Act Personal, do try and look at that and respond to the consultation, because your voice is what matters. Thank you.
Thank you very much.